Okay, so let's talk about money. Um, is there a fee schedule for these? Is it a free market? You can charge whatever you want. How does that work, Doctor?
It is very definitely a free market. You can charge whatever you want. Um, so in some areas, aviation medical exams run into the hundreds of dollars. When I started doing this, I decided to set my fees where I would for a level 3 comprehensive new patient office visit. And that's pretty much where it has been. I usually advise new AMEs to check with other AMEs in their area and see what the going rate is. The reason for that being one doesn't want to be on the high end or the low end. You want to kind of be right in the middle of what the going rate is in your area. You know, the other question that comes up is, can you make a living as an AME? And the answer to that is, well, maybe, maybe not. If you live in an area, for instance, Minneapolis, which is a hub for many airlines, there are thousands of pilots who live in Minneapolis. You know, you might be able to make a living. If you live in a smaller community with fewer pilots, probably not.